Governor, do you expect communion will still be allowed in Christian churches? And also, I know there's still capacity limits, but is there any difference for weddings and funerals within a house of worship, and how could that go?
Questions. So we do expect communion. Communion, in the Catholic faith, there is no Mass without communion, so that's very important. So yes is the answer. You highlight why this is a little complicated and why we've had so many discussions. In different faiths, there are different traditions. Many of them involve being close, having communion. There will not be the cup, the precious blood, but there will be the host. And there'll be all kinds of regulations around that. The answer to your other question is no. Those would, any Mass, a funeral is a Mass, a wedding is a Mass, so all of those services, or services, any service that would be a service in a house of worship would be according to the same new rules, which is 25%.
Governor, on the churches, just to stay on that for a second, you talk a lot about your own faith. Can you kind of walk us through your process for whether you'll actually go to church, and then also specifically at your church, if you run into a situation where there are a lot of people there, I mean, are you going to check ahead of time to see how many people are going, things like that?
Yeah, okay. So my family and I are Catholic, and our church is St. Raymond's in Providence on North Main Street. We have been celebrating Mass virtually. Our Pastor Peroni's been fabulous. He has it on Facebook every Sunday. And to his credit, he's been telegraphing to the parishioners. He said last week he spent the whole time marking out 6 feet distances. He has caution tape everywhere. They're going to take it seriously, which is terrific. We will go. Yes, I will go, assuming I'm not sick and my kids aren't sick, but assuming we don't have any symptoms. I plan to start going to Mass again. I plan to just follow the rules. We will wear a mask. We will bring hand sanitizer, and we'll follow the rules. So I'll probably, if we were to get sick, I would say, obviously I wouldn't go. I'm probably going to suggest that I will suggest to her that she not do it. We'll see how that goes. But that's how our family will handle it.
Governor, Rhode Island is 25%. Massachusetts is 40% capacity. Are they being too aggressive, or are we being too conservative?
It's a judgment call. It is really a judgment call. The answer is, I think there's no right answer. No one has ever done that. No governor has ever had to do this. So we're all doing our best, and I respect Governor Baker. I think he's doing an excellent job. How did I come up with 25%? Through a lot of conversations with faith-based leaders. And by the way, it is high. That is a high number. If you think of, say, the cathedral, St. Peter and Paul, or you think of a large synagogue, they can hold maybe 1,000 people. So this is a big deal, allowing a couple of hundred people in one place. So how did I get comfortable? I'm relying on the faith-based leaders to do everything possible to keep their congregants safe. There's some people who say, Governor, it's hundreds of people. It's true. But I trust the priests and rabbis and imams to do the right thing and follow the rules.
One of the guidelines is limited singing. Do you take that personally?
I do not. I do not take that personally. I have
a question about Memorial Day. I was reading how your dad served our country in World War II, Joseph Raimondo, on the USS Amsterdam. And I also read how your father was very involved volunteering with scouting.
Yeah.
I'm just curious if some of the things you learned from him you've implemented during this crisis.
No, thank you, and thank you for asking about him. He passed away 6 years ago, last Saturday, so he's been on my mind. Yeah, my dad was a World War II vet. He was part of that greatest generation. A highlight of his life was serving the country in the Navy. He left Mount Pleasant High School a year early to volunteer, like so many folks did, to serve their country, and then went back later and got his degree from Mount Pleasant High School. Yeah, I think about him all the time, and service is really what it's all about. This is a hard time for so many Rhode Islanders, and I'm just trying to serve, and in a way that I'm not comparing what we are doing to serving in the Second World War, but right now I'm running a big operation and I'm leading a lot of people in the National Guard, in state service, leading people to try to serve the people of Rhode Island, making a lot of mistakes as we go, but that commitment to service is something we can learn from every veteran. I think especially those World War II vets. I mean, they laid it all on the line and were so humble, and I think we can all learn from them.
Governor, there's at least one live music venue.
Bill, okay, hang on.
Sorry, one at a time. Bill and then Michael.
We're going to do you in a minute.
Hi, Governor. There's at least one live music venue in the state that's already announced that they're returning to business on June 12th. Would guidance around religious services be similar to what a live music venue should apply? You've got people singing in a space. Are you looking to do something like that, 25% capacity? Do you see similarities there? And what's your message to a venue that's announcing that their schedule is back on effective June 12th?
Yeah. So that's a risk to do that, because they may or may not be allowed to do that. We'll be in phase 2 then, and I fully expect in phase 2 we'll be having indoor dining and some amount of a lot more commerce. But whether or not that would be allowed, it's very likely it won't be allowed. So I wouldn't be making those promises, because chances are, or it could be, you're going to not be allowed to do that. And if you do, then we're going to have to enforce the rules and not allow it. No, I think a music venue is quite different than a church or a synagogue. And the way we're thinking about it, we have endless hours of conversation trying to think of how to get it right. So, a church can be a more controlled environment, and there's someone presiding over the environment. It's limited in time, and there's a pretty good ability to keep people apart. Concert, it's harder. I mean, it's just hard to enforce social distancing in a music venue. Now, indoors is much more dangerous than outdoors. So we look at indoors versus outdoors. But the real thing is, can you enforce social distancing? Can you reasonably be expected to enforce social distancing? And will everyone wear a mask? Can you turn folks away if they don't have a mask? Can you, actually keep people 6 feet apart? And that's how we're going to think about it.
But they would be allowed to what I saw was that this particular venue indicated that they would take those steps that you just described. Are they?
I don't know what the venue is, so I don't want to speculate. But listen, I can't make policy on the basis of what one venue is willing to do. We're looking at, across the board, is it reasonable to think that in every bar, for example, they will enforce social distancing? And like an example of bars, I think the answer is no, because folks congregate at the bar. So we're going to take it a venue at a time, at least in phase 2. For phase 3, we're looking more along the lines of just guidelines and then asking people to follow the guidelines. But phase 2 is still going to be like a setting by setting set of guidance until we're a little further along. I'm sorry.
Governor, you talked extensively about veterans in Memorial Day and ceremonies and services. There have been news reports that the federal government is limiting deployments to 89 days so that National Guard troops who are active and deployed are not reaching the 90-day threshold to qualify for benefits, education, otherwise. Does that affect Rhode Island National Guard troops, and what is your reaction to that?
Yeah, I hadn't followed that closely, so I don't want to talk about a hypothetical. If it is as you described, that's obviously disturbing. I mean, that isn't something that I would be supportive of, but I have to look into it and get back to you.
Governor, I understand that the National Guard checkpoints at the airports and the highways have been disbanded. Why make the decision to disband them now when people could be coming into the state for the beaches, snowbirds coming in from out of state? Why now?
Yeah, so a couple reasons. One, because there was not much work to do, to be very honest. It's a resource allocation. I need to allocate resources, including the National Guard, to where we need them. We need them a lot more now with contact tracing than at the border. At the time I decided to disband them, which I think was a week or two ago, the numbers were absolutely negligible. I mean, we were deploying resources to stop a couple of cars a day, so it just didn't make sense. Also, for phase 2, there'll be different and more relaxed limits around travel. I haven't yet decided exactly what they will be, but you can imagine that they'll be more relaxed and that kind of a thing wouldn't be necessary. So that was really just a resource. We're constantly evaluating where do we deploy people in the best, highest use.
And on churches, because there are going to be new requirements, just like for small businesses to, put in social distancing measures and clean, any thoughts about giving financial assistance to churches to help them with these efforts?
It's not something we're considering right now. I will say this, everyone is struggling right now, and we're going to do everything we can to help everyone on an individual basis. If we can give somebody a hand, if they're struggling, we'll do everything we can, but that's not really on the agenda.
Governor, after talking with people in the performing arts community, they feel a little left in the dark, left out of the conversation. Could you address that community and give sort of insight on when they can allow for in-person dance classes, that sort of thing, youth theaters this summer?
So some of it, certainly for the summer camp, for those performing arts that want to have summer camp, I hope they do it, and they can follow the summer camp guidance, which is to begin on June 29th. So the dance classes and such, consider that, music classes. For the rest of it, I'm just going to ask you to wait a few more days or until Friday or early next week. That'll be part of the phase 2 discussion, and I'll have more to say then. But let me say, I hear you. I mean, look where we are. PPAC, I mean, we're here. It's tough. It's sad that they haven't been able to operate their business, and we're going to try to get them back into business as soon as we can.
And those centers hold their recital here at the Vets. Do you see allowing something like this, an audience spread out?
At some point in time, yes. That's what we're working through right now. It's all back to the question I answered here, like, do we have confidence that there can be effective social distancing at a statewide level? And that's what we're trying to work through.
Governor, you're talking about resuming religious services with restrictions for the weekend of May 30th. But some religions, particularly Judaism and Islam, will begin their observances the prior day, May 29th, because it's a Friday. Is that included in the weekend?
Saturday is the weekend.
Governor, a group of the restaurants have got together, a coalition, and apparently they're pushing for a June 1st deadline as far as inside dining.
I'm trying to get there.
Okay.
I'd like to get there. It's a very reasonable ask, and we are working. Just give me a little more time. I'm trying to get there.
With that, either you or Dr. Scott, how much does air conditioning affect the virus? We've seen the display where there's one person sitting, and then as soon as the mask comes off because of the air conditioning, it can spread, and that's why the outside dining is so much more effective. How much does, in lack of a better word, but the virus love air conditioning and a ceiling and walls?
What's beneficial in combating the virus is being able to have access to adequate airflow that happens most naturally outside, where it can be disseminated as opposed to lingering. If you're inside and there is poor ventilation or not a lot of airflow, particularly natural airflow, then it is more likely for the virus to hang around as people cough or sneeze without having some form of cloth face covering over their mouth and nose. So it's really why each element of what we're discussing is a critical piece to helping us stop transmission. Having air conditioning set up and being able to allow for airflow, preferably with windows open, and most beneficially outside, minimizes the chances that someone would be exposed by lingering viral particles in the air.
Now, doctor, you're infectious disease.
Yes.
I mean, how confident would you be about going inside dining? Because on hearing that, I'm not confident about going inside or anything. And maybe we should just think more about heat lamps. And it seems the more you're outside, the better your chances to not contract the virus.
Science is definitely showing that to us, and this has been such a dynamic process. It's why infectious disease is considered one of the best specialties in my mind, because you're always learning, and there's constantly emerging information that is occurring. Being able to really follow those rules and have the clear understanding that there is public health guidance and science behind them helps lead to me feeling more comfortable in those situations. It's why we really are encouraging the cloth face covering, some form of ability to prevent the virus from protruding even with normal conversation. The additional 6 feet distance also helps do that. The additional frequent environmental cleaning also makes a difference. So when you have each of those elements in place, it significantly decreases the risk of transmission. And the more everyone understands that and the more everyone follows the rules, the better we can be in going forward, because we have to live. We have to be able to engage in activities that will support our economy, and our focus is to be able to do it as safely as possible and adjust to the science as we go forward.
You know, Governor Raimondo's going to go back to church. Not to get too personal, but are you also planning on going to a house of worship?
Yes, the faith community and faith is very important to me and to our families, so very much look forward to continuing that engagement.
Dr. Alexander Scott, do you have an updated number on the long-term care deaths? And conversely, do you know of the 538 fatalities, how many of those people would have been considered healthy Rhode Islanders without underlying conditions?
That's a number that we are continuing to assess. It's somewhat challenging sometimes to be able to get that in detail because of the different ways that the unfortunate deaths occur. But by and large, most individuals who have passed away, unfortunately, have some form of underlying illness or are of an older age that sets them up. We are less commonly seeing people who were previously healthy with no underlying illness and no risk factors pass away.
Doctor, I think there's been some questions about air conditioning because people have an understanding that some types of illnesses are associated with air conditioning, like Legionnaire's disease. Can you distinguish that sort of situation from this?
Yes, yes. Legionnaire's disease is a bacterial infection that is associated with a particular water source that contributes to its dissemination and risk of infection. That's different from this viral illness that's transmitted by droplet and has a different approach in how people are infected. I wanted to finish with answering your question about the unfortunate fatalities that have occurred. 6 of the ones announced today were associated with either an assisted living facility or a nursing home, and we'll be happy to provide additional data to you on that.